One nerve controls 80% of your entire body right now. That same nerve is the hidden reason behind your daily anxiety. It connects your brain directly to your heart and your gut. It is called the vagus nerve, and almost nobody talks about it. The vagus nerve is the longest cranial nerve in the human body. It travels from your brainstem all the way down to your colon. Along the way, it passes through your throat, heart, and lungs. Its name comes from Latin for wandering. It truly wanders everywhere. The vagus nerve is actually two parallel nerves, left and right. It contains roughly 100,000 individual nerve fibers bundled into one cable. Think of it as the main electrical cable of your nervous system. It is the primary highway of your parasympathetic nervous system. The parasympathetic system is your body's rest, digest, and heal mode. Without the vagus nerve, your body cannot shift out of stress mode. The vagus nerve carries signals in two directions at the same time. 80% of vagus signals travel from your body up to your brain. Only 20% travel from the brain down to the body. Your body constantly reports its full internal state directly to the brain. This is why gut feelings are literally neurological signals to your brain. Your gut contains 500 million neurons. It is your second brain. The vagus nerve is the direct communication line between gut and brain. When your gut is inflamed, the vagus nerve alerts your brain immediately. When your brain is stressed, the vagus nerve signals your gut instantly. This bidirectional connection between gut and brain is called the gut-brain axis. The vagus nerve also regulates your heart rate in real time. It slows the heart during calm states and releases the brake under stress. Heart rate variability, HRV, is the direct measurement of your vagal tone. High HRV means your vagus nerve is strong, flexible, and healthy. Low HRV is directly linked to anxiety, heart disease, and chronic inflammation. Elite athletes and experienced meditators both share extremely high HRV scores. The vagus nerve controls release of acetylcholine, your body's calm chemical. Acetylcholine slows the heart, reduces inflammation, and calms the gut. Without adequate vagal tone, acetylcholine stays critically low at all times. Low acetylcholine keeps you locked in a low-level stress state permanently. This is how chronic stress becomes physically embedded in your body over time. Most people never address the vagus nerve and wonder why they stay stuck. Low vagal tone is the medical term for a chronically weak vagus nerve. Roughly 70% of people with chronic anxiety have measurably low vagal tone. Low vagal tone keeps your nervous system locked in permanent fight or flight mode. In this state, your threat detection system runs on constant high alert. Small stressors feel catastrophic because your vagal brake simply is not working. Scientists call this hypervigilance. Your body cannot tell real from false alarms. Panic attacks happen when the vagus nerve fails to break the stress response. Heart pounds, breathing shortens, gut clenches. All vagus nerve malfunction at once. Social anxiety is strongly and consistently linked to low vagal tone in research. Low vagal tone reduces your ability to accurately read other people's social signals. You misread neutral faces as threatening when your nervous system is miscalibrated. This is polyvagal theory. Dr. Stephen Porges mapped exactly how this happens. The gut-brain axis breaks down when vagal tone drops chronically low. IBS, irritable bowel syndrome, is now officially classified as a gut-brain disorder. The vagus nerve loses its ability to regulate gut motility with low tone. This causes alternating bloating, constipation, and diarrhea in millions of people daily. GERD and acid reflux worsen significantly when vagal nerve signaling is impaired. Nausea and lost appetite during stress are the vagus nerve actively misfiring. The vagus nerve is also the cardiac nerve. It directly controls your heart rhythm. Low vagal tone causes heart palpitations even without any underlying heart disease. Irregular heartbeat in anxious people frequently traces directly back to vagal dysfunction. Your resting heart rate stays elevated when vagal tone is chronically too low. Elevated resting heart rate independently predicts earlier all-cause mortality in studies. The heart simply cannot rest properly without a consistently strong vagal signal. Chronic fatigue syndrome is strongly linked to vagus nerve dysregulation in the literature. Low vagal tone reduces mitochondrial efficiency. Your cells produce significantly less energy. Brain fog partly comes from reduced cerebral blood flow caused by poor vagal tone. Your prefrontal cortex receives less input when the vagus nerve underperforms chronically. Decision-making, memory, and creative thinking all suffer from low vagal tone. You are not lazy or broken. Your vagus nerve is simply undertrained. The vagus nerve controls the inflammatory reflex, a master immune system switch. When vagus detects tissue damage, it triggers powerful anti-inflammatory signals immediately. This is called the cholinergic anti-inflammatory pathway, a discovery made in 2000. With low vagal tone, this anti-inflammatory pathway stays chronically switched off. The result is systemic low-grade inflammation, quietly driving disease throughout the body. Autoimmune flares, joint pain, and skin conditions all link directly to low vagal tone. POTS, postural orthostatic tachycardia syndrome, is a vagus nerve disorder. In POTS, heart rate spikes over 30 beats per minute just from standing up. The vagus nerve fails to maintain cardiovascular balance when shifting positions. POTS affects an estimated 3 million Americans, mostly women under the age of 35. Dysautonomia is the broader category covering all autonomic nervous system dysfunction. The vagus nerve is the core of the autonomic system and breaks down first. Depression and low vagal tone have a powerful and bidirectional relationship. Low vagal tone reduces the brain's ability to regulate emotional states. Emotional regulation circuits in the brain depend on constant vagal feedback. Antidepressants work partly by indirectly increasing vagal nerve activity over time. Vagus nerve stimulation is now FDA approved as a direct treatment for depression. VNS therapy delivers gentle electrical impulses directly to the vagus nerve. COVID-19 directly damages vagus nerve fibers in a large portion of patients. Long COVID symptoms, fatigue, brain fog, palpitations, are vagus nerve injury signs. MRI studies confirm structural changes in the vagus nerve after COVID infection. Long COVID and POTS often occur together, both pointing to vagus nerve injury. Recovery from long COVID frequently requires targeted vagus nerve rehabilitation. If you struggle with any of these symptoms, Maestrally.com has a program for you. Human social connection is one of the most powerful vagus nerve activators available. Eye contact, laughter, and physical touch all directly increase vagal tone. Loneliness chronically suppresses vagal tone, physically as harmful as smoking. Social isolation measurably lowers HRV and raises inflammatory markers in the blood. Safe social connection literally exercises your vagus nerve and builds its strength. Community and belonging are not luxuries. They are biological survival requirements. Trauma gets stored physically in the body, specifically in the vagus nerve. Traumatic experiences push the vagus nerve toward chronic shutdown or hyperarousal. Peter Levine's somatic experiencing therapy directly targets vagal dysregulation from trauma. The fawn and freeze responses are both low vagal tone survival states. Unresolved trauma keeps the vagus nerve cycling between shutdown and panic. Healing trauma means literally retraining the vagus nerve to recognize safety again. Polyvagal theory identifies 3 distinct nervous system states we cycle between. State 1, ventral vagal, safe, connected, calm, and creatively engaged. State 2, sympathetic, fight or flight, mobilized, anxious or angry. State 3, dorsal vagal, shut down, frozen, disconnected, or depressed. Most people with anxiety or depression cycle between states 2 and 3. The goal of vagus nerve training is to spend more time in state 1. Now let's get to the practical part. How to actually activate your vagus nerve. 3 primary activation methods are backed by the strongest scientific evidence. Method 1. Cold exposure. Cold water on your face or a cold shower. Cold water on the face triggers the dive reflex, a powerful vagal activation. The dive reflex immediately slows heart rate and activates the parasympathetic system. Splashing cold water on your face activates the vagus nerve within seconds. A 30-second cold shower activates vagal pathways and reduces cortisol rapidly. Cold exposure also triggers norepinephrine release, a powerful natural antidepressant. Daily cold exposure for 30 days measurably increases HRV in clinical studies. You do not need an ice bath. Face splashing alone is the minimum effective dose. Method 2. Humming, singing, and chanting directly stimulate the vagus nerve. The vagus nerve passes directly through the muscles of your throat and larynx. Vibrating these muscles through humming creates direct mechanical vagal stimulation. Om chanting in yoga produces measurable increases in parasympathetic activity. Gargling vigorously also activates the same throat muscles as humming and singing. Gargling 30 seconds after brushing teeth is the easiest possible daily vagal exercise. The vagus nerve carries these vibrational signals directly to the brainstem. Group singing amplifies vagal activation through the social bonding hormone, oxytocin. This is why religious singing, choir practice, and group chanting feel so calming. Method 3. Slow diaphragmatic breathing is the most accessible vagal activator. Breathing is the only automatic body function you can consciously control. Slow exhalation specifically activates the parasympathetic branch of the vagus nerve. The 4-7-8 method. Inhale for 4 counts, hold for 7, exhale for 8. The long exhale phase directly stimulates the vagus nerve and slows heart rate. Coherent breathing means 5.5 breaths per minute, the resonant vagal frequency. At 5.5 breaths per minute, HRV reaches its measurable maximum for most people. Box breathing, 4 counts in, hold, out, hold, also strongly activates the vagus. 5 minutes of slow breathing daily measurably increases vagal tone over weeks. Yoga activates the vagus nerve through both physical movement and breath control. Inversions like legs up the wall shift blood pressure and activate vagal reflexes. Forward folds compress the vagus nerve in the abdomen and stimulate it mechanically. Shavasana, the final yoga rest pose, produces measurable parasympathetic activation. Meditation activates the vagus through sustained attention to breath and body signals. Loving-kindness meditation specifically increases vagal tone and reduces loneliness. 10 minutes of daily meditation produces lasting structural changes in vagal circuits. All these methods work because they target the root cause, not just the symptoms. Beyond the basics, there are advanced tools for deeper vagal nerve training. Transcutaneous vagus nerve stimulation, TVNS, is now available as a wearable device. These devices deliver gentle electrical pulses to the ear, a vagal nerve branch location. TVNS devices show significant HRV improvement in clinical trials for anxiety and depression. TENS units applied to the neck can also non-invasively stimulate vagal pathways. FDA-cleared TVNS devices are now available without a prescription and increasingly affordable. HRV biofeedback trains you to consciously optimize your vagal tone in real time. Apps like Elite HRV and HeartMath guide your breathing using live HRV data. Biofeedback shows your HRV graph in real time as you breathe and adjust technique. Within weeks of daily biofeedback, most users develop measurable, voluntary vagal control. Elite HRV biofeedback is used by military special forces and Olympic athletes worldwide. Voluntary control of heart rate variability was once considered impossible. Not anymore. Diet directly influences vagal tone through the gut-brain axis and your microbiome. The vagus nerve constantly monitors gut bacteria populations and reports to the brain. A fiber-rich, diverse microbiome produces short-chain fatty acids that strengthen vagal tone. Processed food and sugar reduce microbial diversity and directly weaken vagal signaling. Fermented foods, yogurt, kimchi, kefir, directly increase vagal activity in studies. Omega-3 fatty acids enhance vagal tone and reduce the chronic inflammation it monitors. Master Lee combines ancient nutrition wisdom with the latest vagal nerve science. Visit maestrolee.com to get the complete vagus nerve diet and supplement protocol. Sleep is when the vagus nerve performs its deepest nightly repair and reset. During slow-wave sleep, vagal tone reaches its highest level of the entire day. Sleep deprivation reduces vagal tone by up to 30%, equal to chronic stress. HRV peaks at the end of deep sleep, the most powerful vagal restoration phase. Nasal breathing during sleep activates vagal pathways significantly more than mouth breathing. A consistent sleep schedule synchronizes your vagal rhythms with the circadian clock. Here is your complete 30-day vagus nerve activation protocol starting today. Days 1 through 7, morning face splash, 5-minute 4-7-8 breathing, and daily humming. Days 8 through 14, add gargling, a 10-minute evening walk, and 1 fermented food. Days 15 through 21, begin HRV tracking, add omega-3 supplements, and weekly yoga. Days 22 through 30, cold shower, daily meditation, and social connection as medicine. By day 30, most people report measurably higher HRV and significantly reduced anxiety. Track your HRV every morning before rising. The trend over time matters most. A consistent upward HRV trend over 30 days confirms your vagal tone is building. The vagus nerve is trainable, like a muscle. It grows stronger with consistent practice. Start with just one technique today. Your nervous system will thank you for life.